as we've said, COVID-19 does not distinguish between the foot that's okay and the foot that isn't. And so people continue to call us and they have problems with their feet. And in many cases, our senior populace is plagued with toenails they can't trim and calluses that they can't trim and that become sore. Toenails and calluses become much more important in terms of getting anything done about them, especially if you have poor circulation and even more so if you're diabetic. What happens is that the simple toenail that needs trimming, that might be thick, can become ingrown. The thickness itself can be pressing from a shoe. And with diabetes, many of our patients lose sensation. So they don't feel pain. And when they do feel pain, usually that's a very bad sign because by then, things have been brewing for quite a while. So around the nails, we can see here even some splitting of the toenail, which causes patient concern. And this patient is diabetic and had to wait to come in because of the COVID virus. Then on the bottom of the foot, we see this callus formation. It's really not that thick. But what's the problem with this foot? The problem is that because of diabetes, we tend to claw our toes. Patients spread their feet apart wider because they lose sensation and they need more balance. So they hold onto the ground by clawing toes and spreading their feet wide, just like the baby walks when they first begin walking. So when these toes claw up, guess that what does to the bottom? The bottom of the foot is pushed down even more, and the fat pad that used to be down here shifts up into the base of the toes. So it belongs way down here. We can't move the fat pad back, so the bone gets exposed to excessive pressure. Your skin is trying to help you out when it makes a callus or a corn. And I know it's not much help because it builds up trying to protect you and then it gets sore from its very own thickness that happened. So the rest of the issue around our patients or seniors is, of course, checking the pulses of the feet, of which there are two, one behind the ankle, one on top. And in this case, the skin temperature is warm, but the pulses are absent. And we have tested this patient before to show that they don't tend to feel normal. And this little filament that many physicians use to check sensation, particularly in diabetic feet, isn't felt very much, particularly in the ball of the foot. That's where the sensation goes first. So why is it important? Well, what they've determined is if you can feel this, you're probably protected against, believe it or not, something dropping off your nightstand into your shoe and causing a wound. That's right, I've lost a foot to a penny because the patient couldn't feel. So without sensation, the patient can't tell how thick the calluses are. And on top of that, sometimes the callus looks okay and the patient doesn't feel anything, but after trimming the surface, there's a wound underneath. This patient hasn't had one of those for a very long time because we've protected his feet by ongoing foot care at 2-month intervals, checking the skin, having the patient use moisturizing cream, wearing diabetic socks that don't pinch the toes or press too hard around the lower leg, and wearing diabetic shoes. Once upon a time, there were one pair of ugly shoes. So, I won't say this is beautiful, but I think it looks like an average athletic shoe. It has extra space in the toe box and width, and it has room for the insert that you can see has been adapted to take pressure off the callus. And now we'll go ahead and trim up the toenails. And if you're non-diabetic and there are nail clippers that are designed for toenails. Now, in normal times, I wouldn't recommend using those that look like this, but there are some like this available online, and we'll give you a reference for that. The key with this is, though, don't attempt this to do on your own. I would have a hard time bending down my own toes with all my training and trimming my nails without cutting myself if I was using one of these. So I use more of a standard nail clipper, and they call them toenail clipper. They look like your fingernail clipper. But for purposes here to demonstrate the proper way to use this instrument, should someone be attempting this, you must only put the nail clipper under the nail, not down this way. You can see, if you look carefully at this, that the bottom edge of my nail clipper is on the underside of the nail. And you can see on the side here, I'm not going to cut any skin. I also don't take the whole nail at once. On a fingernail clipper, you might tend to use that type, come right over the whole thing like we do on our fingers. Do not do that. So I took part of it there, and then I come across, and mostly we've gone straight across. Once again, here, I start under the edge of the nail there. You can see the clipper under the edge. And you don't want to cut them too short. If you ever cut your fingernails too short, you know it gets sore because there's too much tension. And you can see the skin is left intact. Yes, I've been doing this a couple of years, so it's easier, but we'll come over to this toenail that he split here, and I'll start the same way, and then I'll come across. Now, normally I would tell you, if you get something like this, you really shouldn't be going down the sides like this. I have to here because he has that little piece of nail split. But even with that, no skin is clipped. Here, the big one, if I try to take that much nail, I can't even cut through it, even with this commercial nail forceps. So, what do? I make sure my nail clipper is, I can feel the underside of that nail. I take a little clip and a little bit more, and then come across. Here there's another split in the nail. I'm going to take that out.
Split there too?
Here I'm starting on this side and working back the other way. Once again, it's too much even for me to clip that much, so I start with a smaller bite. Thus the expression, tough as nails. And the reason these nails really need to be maintained at this length, look at how the fifth toe hugs his fourth toe. If we didn't take that off straight across, and I didn't go down into the side, but I did get the corner of that as I came across, it would cut into the fourth toe and have a wound. And if you're diabetic without sensation, you wouldn't even know you had it. We don't recommend use of rotary filing at home, but I will use the rotary nail file. We'll provide you with a link for a recommendation for a really good emery board. It's a little coarser and washable, reusable, that is best for your toenails. One of the things that definitely plagues our senior patients, and even non-seniors, particularly more true in seniors, is dry skin that tends to get associated with patients as they age and as circulation decreases to the extremity. Again, in the diabetic patient, this is even more of a problem. Yes, diabetes, amongst other things, will cause increased dry skin. That dry skin can cause cracks and fissures around the heels. Here you can see mild cracks and certainly the dryness of the skin. Those cracks can become painful and actually develop into wounds. So what's the prevention? Moisturizing. Now, the women are actually a lot better at this than the men, I must admit. And that said, I think that all of us can improve and prevent some of these terrific problems, even in an area that's just a callus, the tissue just, as it dries out, it lacks its integrity. It doesn't bond together well and will break down faster. Well, it's not just for purposes of healing up a crack. It's also for the purpose of preventing the skin from breaking down. And it will feel a lot better. So people tend to use creams that they buy over the counter. And if your skin is moist, okay, that's all you need. But if you're having problems, then we do have creams more specifically designed to help dry skin in the feet. Now, there are various strengths of these creams, and many of them have this word, urea, U-R-E-A, as one of the main ingredients. And this Gourmet cream, you'll see, says 20%. So that's one of the lower strengths. And in the case we're treating today, where there really aren't any deep fissures, this would be adequate. In addition, this particular one has got some other ingredients of mineral oil and such, which help increase the benefit of the particular cream compared to many others. So that's that one. Now, when we get up into more deep cracks and chronic scaling of the skin, the answer is that you have to increase the strength of the moisturizing and possibly frequency. That are once a day might go twice a day. This particular one is at 40%. And it has other ingredients that help. This word here, keratolytic, means taking off the scaling. Combined with a little scrub brush and a pumice stone, you now got a little bit stronger weapon in your armory to help get rid of this dry skin and prevent these wounds. So that's the varied strength from 20 up to 40, and some in between, with various combinations of other oils that will greatly benefit moisturizing of the skin. Finally, if you need more than that, we have available our gel socks, and we will provide you a reference for those, and they come from men and women. They're kind of a one-size-fits-all. Now, I can tell you from personal experience that the gel sock adds a great deal of ability for this to help you out. It's just like a little footy. You only need to wear it 2 to 4 hours in the evening. You get home, get shoes off, want to kick them off anyway. And the gel in this has various oils in it that even by itself will improve the moisture and diminish the drying and cracking. The second thing that happens with this, you can use even less cream. So you're making the special cream last longer and more effectively moisturizing your skin. They, again, come for both men and women. So the gel socks are best worn just for a couple of hours, 2 or 3 hours in the evening. Do not wear them all night long. It's too much moisturizing. So right now, because of limitations placed on us by the COVID pandemic, we're having to find alternatives for our exercise, such as walking, and it's a great one. And doing that, the more time on the feet, more gardening, more house repair, all of the above. That means we got more instances of tired, aching feet now than when people were actually working. So a foot soak can be very soothing. This particular product is an excellent combination of salts and other ingredients that will soothe your feet if used on a regular basis. It calls for approximately 15 minutes of a soak. It will really help. It will really help you relieve some of that aching that's going on. So combining the foot soak and then adding the moisturizing cream in is a great combination and a great way to improve the health of your skin.